Hi, this is Dr. Bharadwaz. I am CEO and homeopathy doctor at Fidicus Homeopathy. Today we will know about one of the important topics, that is mental disorder. So it is very essential to understand what is mental disorder. So normally what happens is, if you are doing anything, so if you are in sadness, people label you as depression, or if you wash your hands 2 to 3 times, they will be labeling you as OCD, obsessive compulsive disorder. But it should not be done. There is a specific criteria that should be satisfied to name it as a mental disorder. Every sorrow is not depression. Every 2 to 3 times you are washing your hand or doing something is not OCD. You have to understand what is mental disorder before you know anything about the other details of mental disorder. Now we will check what is a mental disorder. This mental disorder is defined by many people, but one of the standard definitions we have to take, and it is the allowed definition throughout the world, is from DSM-5 and APA. DSM-5 is a diagnostic and statistical manual of mental disorders. This is the criteria, or it is the classification system and diagnostic tool developed by American Psychiatric Association. American Psychiatric Association is a leading psychiatric association in the world. It is the association of psychiatric practice, whoever practices the psychiatry, and also whoever does research on psychiatry, and also academicians who teaches, who are the students of psychiatry, or who are the lecturers or professors of psychiatry, all can be under American Psychiatric Association. This association has developed classification and diagnostic tool. That tool is known as DSM, Diagnostic and Statistical Manual. This American Psychiatric Association is located, headquartered in Washington DC, USA. The latest version, there are many versions of DSM. The latest version is DSM-5, which was released in 2013, and there are updations to it. The current update is DSM-5 TR. TR means text review. It is a fifth edition. It is released on March 2022, and it has many changes compared to DSM-5. So now whatever we are discussing about what is a mental disorder is from the perspective of, or what is given in DSM-5 TR 5th edition. That definition we are going to check now. So mental disorder, the definitions of mental disorder is given in the section of basics. There are different sections in the DSM-5. That is the first section. The name of the first section is basics. In that first section, they have defined what is mental disorder, that you have to understand. And coming to mental disorder, what exactly is a mental disorder? You have to understand a few terms here. A disorder is a syndrome. Syndrome means collection of symptoms. See, for example, if you are heart disease, if you have lung disease, what happens is the pathology can be established. What is happening to the structure there? What is happening to the function there? What is the bacteria or something else is coming and doing there? But in most of the psychological disorders, what will happen is you will not see any pathology here. Most of them are diagnosed by symptoms. That's the reason a mental disorder is a collection of symptoms. Maybe sometimes it will have pathology, it will have structural changes in the brain, it will have chemical changes in the brain, it will have physiological changes in the brain. But most of the mental disorders will not have that. That's the reason it is considered as collection of symptoms characterized by clinically significant disturbance. This is a very important one. You cannot say it is a mental disorder unless there is a significant disturbance. When you observe clinically, when the patient is suffering, or the doctor can observe, or the attendants of the patient can observe, there should be significant disturbance. That is one of the important criteria for deciding it as a mental disorder. And where is the disorder? Disorder is in cognition. What is cognition? Cognition is the higher functions. So normally in psychology we say emotions and basically the behaviors and emotions are the basics of a human being, the mind of a human being. Other than emotions and other than behavior, all the things are known as cognition. Cognition includes intelligence, cognition includes learning, cognition includes perception. Except emotion, the basic emotions, basic seven universal emotions like anger, fear, distress, or sadness, happiness, contempt, surprise, jealousy, these are all the emotions. Other than the emotions, any disturbance is considered as cognition. If there is significant disturbance in cognition or emotion or behavior of the patient, this is very important. Significant disturbance is very important word here. And there are three words given here. First one is psychological, biological, and developmental. Psychological means I have said you cannot observe any biological changes or structural changes or functional changes or changes in the chemical composition of the brain, but still they can be some mental disorders that are classified under psychological here. Biological means, there can be structural change in the brain or any part of the body, or any changes in the hormones or neurotransmitters, and any other thing. And also one more word used here is developmental. When the baby is developing, any disturbance in the development, you can see, while the baby's brain is developing, even in that process there can be disturbances. Underlying mental functions, what are these mental functions? Here it is clearly mentioned: cognition, emotion, and behavior. These are the mental functions. So it is clear that mental disorders, you have significant disturbance. It is a syndrome, it is collection of symptoms, and it should have clinically significant disturbance. That disturbance should not be a minimum one. If someone dies, I will cry for it. It is not a mental disorder. And also where this happens, it happens in cognition, emotion, and behavior. If you see changes or significant changes in the patient's cognition, emotion, and behavior, it is also considered as mental disorder. This dysfunction represented in psychological, biological, and developmental process in the underlying mental function. When you see the characteristics of mental disorders, you can see there should be distress and disability. What is distress and disability? Distress is suffering. When you suffer enormously, it is known as distress. So simple weeping or simple crying is not known as distress. If the suffering is severe, that we call it as distress. And what is disability? Failure to do something. For example, what are you failed upon? For example, social. You are not able to maintain sufficient relationship with your wife or with your peers or in your company or in your work area. If you are not able to have proper relationships, or it makes you disabled, you are not able to have social contacts, that is also known as mental disorders. And occupational. So when you go to work, you are not able to work and you are fired from the work, you are not able to achieve your goals. All this comes under occupational. And the important other things, anything than disability and social activities, even in other activities we have severe distress and severe disability, it is considered as mental disorder. The important word you have to understand here is significant. It has to be significant, and it has to be significant distress or disability in social, occupational, or any other activities, then only it is considered as mental disorder. In order to label anything as mental disorders, you should have these criteria satisfied. Then you have to understand very important thing: what is not a mental disorder. You can see which is not a mental disorder. So what is not a mental disorder is socially deviant behavior and conflicts. What are socially deviant behaviors and conflicts? For example, in your town, you are a thief, you are robbing something. So that is socially deviant behavior or conflicts. Or else, if you are doing the things that are not sexually accepted by the community, then that comes under socially deviant behavior or conflicts. Anything that is done by an individual and it is not accepted by the society is not a mental disorder. For example, we have seen lot of movies in that there will be a psycho villain and he will be killing many of the people. It is not a mental disorder. Okay. Sometimes it can have, for example, if there are any tumors in the brain, especially there is a place in the brain known as amygdala. Amygdala is the center for fear. So if there is any tumor or any lesion in the amygdala, what happens is they become fearless. They do whatever they want. They become psychos. They become thieves, they become robbers, or they become murderers because they don't have any fear. In such cases, it is considered as mental disorder. You can see it here. Unless the deviance or conflict results from a dysfunction in the individual. Dysfunction is the same thing. Any tumor, any lesion in the brain, or any significant abnormality, then only it is known as mental disorder. Otherwise, it is not known as mental disorder. So mental disorder has to have some pathological basis. Without it, when an individual is doing anything against the society which is not accepted in the society and he doesn't have any mental disorder, then it is not considered as mental disorder. The socially deviant behaviors and conflicts are not mental disorders unless there is some pathology. That's what this sentence is going to say from DSM-5. And one more thing, what else is not mental disorder? Acceptable culturally approved response. For example, someone has died in your family, you are weeping for it or you are crying for it. So they cannot label you as depressed. It is not possible. So any culturally acceptable appropriate response like this, for example, you have a heartbreak, you are grieving over it, it is not a mental disorder unless it satisfies the other criteria. You can see an acceptable or culturally approved response is not a mental disorder, such as death of the loved ones. Okay, this you have to understand. You have to understand what is mental disorder, which is mentioned in first two slides, and you have to understand what is not a mental disorder as explained in the last two slides. This is the definition for a mental disorder from DSM-5. Everyone has to understand it, and accordingly you have to label the mental disorder. You should not give vaguely, or you should not diagnose vaguely a mental disorder. In Fidicus Homeopathy, you can take two types of appointments for mental disorders. One is online and in person. Online means you can have an audio call or video call of your choice. We can see the patient on online, or speak to him. If you have any reports or the notes by the psychiatrist in your local area, you can share with us. If anything more is needed, we will let you know. You can do them locally and send it back to us. Medicines can be shipped to you wherever you are in this world. If you are in India, it takes 3 working days. If you are in US, it takes 4 working days. If you are in any other country than India or US, it will take 5 working days for us to ship your medicine to the doorsteps. Or else you can come in person and you can inquire about the nearest branch. You can come to the branch and take the treatment. 7997 101 303 +91 is the India code. This is our phone number. You can call us and take the appointment. Fidicus Homeopathy has the highest chance for health compared to any other homeopathic clinic. We have the highest success, transparent treatment, and personal care. Thank you.